Hello, today we'll be studying about kinetics of elimination. Drug elimination is the sum total of both metabolic deactivation of the drug and also excretion. We usually tend to think that it is only related to excretion. Also, some drug will get its effect get eliminated after metabolism, including that we have to consider. Coming to the importance of this kinetics of elimination, it is important in adjusting the dose. Okay, dosage regimen, it is important, and also it will affect the optimal effect which is produced by the drug. That also depends on kinetics of elimination of drug. And three important pharmacokinetic parameters which are related to kinetics of elimination is bioavailability, okay, volume of distribution and clearance. These three things are very much important in terms of drug elimination. So we will study in detail what are these things: bioavailability, volume of distribution and clearance. So bioavailability is the amount of drug which is available at the systemic circulation from the route of administration. How much ever you have administered, what is the concentration of the drug which is present in the plasma? So that is bioavailability. So this is the definition: fraction of administered dose of the drug which will reach the systemic circulation for its action. Okay, so that is the definition of bioavailability in the unchanged form. This is also an important word, unchanged form. This is the definition for bioavailability. And how do you calculate bioavailability is like this. So amount of drug that enters the systemic circulation, which is usually we will obtain from area under curve, okay, divided by dose administered. This will give you bioavailability. Volume of distribution, this is also important terminology. So it is the volume that will accommodate all the drug in the body if the concentration throughout was as same as plasma. Okay, so this is given by the formula dose administered divided by plasma concentration of the drug. Okay, so this is volume of distribution. Similarly, clearance, it is the volume of plasma which is cleared of drug. Okay, in how much amount of plasma the drug is cleared in unit time. So this will give you the clearance value. So clearance is given by rate of elimination divided by C. C is nothing but plasma concentration. So these are three important clinical pharmacokinetic parameters which is very important in case of elimination. And these definitions are also important. These formulas are also very important. It can be asked as a question, solving question, or this formulas only can be a MCQs. So these things are very important. Moving on to the different kinetics of elimination. So you have basically two orders, okay, two elimination process you have. For those drugs will follow either of these things. So it can follow first order kinetic of elimination or zero order kinetic of elimination. One more important thing is Michael-Menten's constant or type of elimination. So that is also there. So majorly zero order kinetics and first order kinetics is very important. So to begin with the first order kinetics of elimination. So here most of the drug will follow first order kinetics, and here the rate of elimination is directly proportional to the plasma concentration of the drug. Okay, plasma concentration, very important. This sentence, whatever I am marking, it is very important. Rate of elimination will depend on plasma concentration. Clearance here will remain constant. Okay, meaning what? If you are giving 100 mg of drug, okay, 50% elimination means, so then after 1 t-half the amount of drug which will remain is 50 milligram. And if you give same so if you give say 200 milligram, so after 1 t-half the amount of drug remaining is 100. Okay, that is what you mean by like rate of elimination is directly proportional to the drug concentration. So at unit time, the amount of drug which is excreted will depend also on the plasma concentration. So clearance remains constant. Okay, says 50% is the clearance. Okay, 50% of the drug is eliminated, so clearance is constant. So if a drug is following first order kinetics, so after 1 t-half, 50% of the drug will get eliminated. Okay, so say 100 mg I am giving, so after 1 t-half, 50 mg is remaining. So after second t-half, so in that 50 also, after 2 t-halves, how much it will get eliminated? It is 75%. How? 1 t-half, 50 is gone, and the next t-half, 50 is remaining, in that 25 I will take. Okay, so together it is 75%. So after 3 t-halves, what happens? Plus 12.5, half of this. So 87.5% of the drug is eliminated, and after 4th t-half, 93.75% of the drug is eliminated. For a drug to get completely eliminated from the body, so we say at least 5 t-halves is required. So this also they keep on asking, so that is why I have mentioned, important it is. Moving on to the zero order kinetics. So in this, only few drugs will follow zero order. Classic example is alcohol. Okay, the rate of elimination in the zero order remains constant. Rate of elimination remains constant, and it will not depend on the plasma concentration. Irrespective of the plasma concentration, the rate of elimination remains constant. Meaning, if I give 100 mg or 1000 mg, only 50 mg of the drug is eliminated. The rate of elimination, that is, it is 50 mg. That much is, I am giving an example. Only that much is only eliminated. It will not depend on plasma concentration. Whether I give 10 milligram or 1000 milligram, the rate of elimination is constant. So that is why the clearance here decreases with increasing dose. Okay, by increasing the dose or plasma concentration, resulting in accumulation of the drug. Okay, so the here a constant amount of drug that is what I was telling. 10 if I fix an amount like 50 milligram, whether you administer 100 milligram or 1000 milligram, only 50 milligram is only excreted. That is what is mentioned here. That is a constant amount of drug is eliminated in unit time. Okay, so clearance is not constant. Clearance decreases with increase in the concentration of drug. Okay, so classic example is alcohol, and all these drugs, phenytoin, heparin, all these, at lower concentration they will be following zero order. At higher concentration they come under, at lower concentration they follow first order. At higher concentration they shift to zero order kinetics. Next slide, this is about plasma half-life. What is plasma half-life? Plasma half-life is the time required for the drug to become half of its original value. Okay, its concentration to become half, that is 50% of concentration. What is the time required? That is T half. So mathematically it is given by this formula. Plasma T half is equal to 0.6903 divided by K. K is an elimination constant. Okay, elimination rate constant, and this means fraction of total amount of drug which will be removed per unit time. Okay, important. And this K is given by clearance divided by volume of distribution. So this two are the factors which will affect the K value, elimination constants. So they can ask in other way, will depend on what? Clearance or volume of distribution, like that. There will be tricky questions. So this I have already mentioned. For a drug to completely get eliminated, it will require 4 to 5 t-halves. And clinical application of this plasma t-half. So it is very important pharmacokinetic parameter in case of dosing. Okay, how much should you administer if a drug is following first order, zero order, all that is important. And also to give loading and maintenance dose in case of drugs which is having long t-half. Okay, all those, it will depend. depending on the T half of the drug, we decide loading and maintenance dose. And this T half also is an important parameter in case of duration of action of a drug. And there is few other terminologies called as biological half-life, which is nothing but whatever we studied, T half. It is the time required for a drug to reduce to its half. But one more terminology, biological effect half-life, means, as the name suggests, effect, it is the time required for the drug to produce or reduce to half of its biological effect. So if the drug is providing a maximum response, like muscle contraction, if you say, so if it is contracting at one particular intensity, for that to reduce half, what is the time required? So that is what is called as biological effect half-life. So this is also one of the important things, Michael-Menton's kinetics. So here the elimination process kinetics will change from first to zero order. This is mainly because of the elimination process gets saturated at one level, mainly because of the enzymes will get exhausted or something like that can happen. So then the kinetics will shift to zero order, where irrespective of the dose, constant amount of drug is eliminated. Here in first order, if the dose is increased, metabolism also should increase, so more enzymes will be required, right? So once it reaches a saturation level where the enzymes or elimination process get terminated, it will shift to zero order. So that is when it has reached a steady state plasma concentration. So here at rate of drug elimination, here it is given by this formula. This is also very important, they keep on asking. Vmax into plasma concentration divided by Km plus C is plasma concentration. What that is also mentioned here. Km is plasma concentration at which elimination rate is half maximum. Okay, C is plasma concentration of the drug. Vmax is the maximum rate of drug elimination. So which will shift from 0 to so first order to 0, phenytoin at higher doses. So it will shift to first order from first order to zero order. Steady state plasma concentration, CPSS, it is one level which is reached when you give a repeated administration of drug at short intervals before the drug levels will come down, like the process of elimination occurs. So at one stage what happens, there is a steady state or plateau state we call, wherein the rate of administration of drug and the rate of elimination of the drug is equal. Okay. So this is called as steady state or plateau state of plasma concentration, and it will take 4 to 5 T-halves for the plasma concentration to reach the plateau or plateau stage or steady state. Okay. After this level, there is only little fluctuation or average fluctuation. So this will help in maintaining the therapeutic dose. This is where you have to maintain the therapeutic levels of drugs. So see, normally this is what was occurring. Okay, like dose response curve was increasing, decreasing, okay, like this. So every fourth T half it was decreasing, right? If you keep on giving doses in between, so the duration of action will increase. So this picture is also showing the same response. So here also daily wise, see, one day this is a dose, this is the response, and 2 days, so the response keeps on decreasing. But if you give smaller doses before it reaches the before its response decreases, in between only if you give at every T half, so the response keep on increasing, and at one particular stage the concentration there will not be much difference. Okay, so this is steady state plasma concentration. One more terminology which is important is target level strategy. So where you need target or a particular level of plasma concentration which is important to be maintained. This is important in case of drugs which is having narrow margin of safety, okay, or in case of drugs which have unquantified data where you need therapeutic monitoring of the therapeutic concentration, like in case of anticonvulsants, antidepressants, all these are having narrow margin of safety. And also in case of drugs which are having shorter half-life, okay, where there will be fluctuating plasma concentration, like in case of penicillin, ampicillin, chloramphenicol, and also with drugs which are having long half-life, their daily or weekly dosing, there also you have to monitor the target plasma concentration, steady state concentration, to maintain loading and maintenance dose also you have to monitor in case of steroid. So what is loading dose? It is initial quick dose which is given to reach the therapeutic plasma concentration. This is very important for drugs which are having long T-half. Okay, long T-half like 72 hours or something like that. Okay, to reach the therapeutic levels we usually give a larger dose initially and then maintenance dose to maintain the steady state plasma concentration. And why do we give large initial dose? Is to attain the desired therapeutic range, okay, because it is having long T half, so it will take longer time to produce its effect, right? So to prevent that we give loading dose. So loading dose is calculated by this important formula which is dependent on target plasma concentration, how much you need, into plasma volume of distribution divided by bioavailability of drug. So this is what is important. So for loading dose, what we see is volume of distribution and clearance. Volume of distribution but not clearance. So this is very important. Similarly, you have maintenance dose. Once you give a loading dose, to maintain the therapeutic concentration, you maintain with loading dose and reach the steady state plasma concentration. So a small amount of drug is given at a regular interval, so as to balance the elimination. Okay, so that is called as maintenance dose. So this is given by this formula. And with this I am finishing this topic, and few MCQs are mentioned. So 4 T halves, this is also mentioned in the slides only. After 4 T halves, how much is the elimination? It is 93% of the drug will get eliminated. Zero order kinetics which will follow, all except. So if you have studied, you can answer what is loading dose, and also I told all those formulas are important. So with that you can calculate and answer. Thank you.